Hello, my name is Tanya, a nurse and peer educator at the facility where I work. I would like to share some unfortunate and troubling information with you. Noncompliance in hand hygiene among nurses is a leading cause of health-acquired infections. Imagine your loved one being admitted to the hospital with a serious but non-life-threatening illness. When 24 to 48 hours later, they acquire an infection from the very place that's supposed to care for and treat them. HAIs occur at an alarming rate here in the United States. According to the CDC, 2.5 million cases occur annually and can be traced back to preventable causes. The most common cause of hospital-acquired infections? Repetitive non-compliance with hand hygiene. HAIs account for approximately 90,000 deaths, which could have been prevented. Compliance with hand hygiene practices include utilizing soap and water or waterless antibacterial sanitizers. Antibacterial hand sanitizers has been approved for sanitizing hands. However, hand sanitizers should not replace hand washing with soap and water and utilized in addition for proper hand hygiene. Sanitizers should not be used in an effort to clean the hands when soiled matter is visible. They are not effective to kill all microorganisms. The proper method of hand hygiene after making contact with a patient, equipment in a patient's room, and when going from one patient room to another is first, wet the hands, utilize the proper soap approved for killing microorganisms, lather both palms, the backs of the hands, removing all jewelry, scrubbing the hands, singing the happy birthday song, or humming it as you like, 2 times from start to finish, and then rinsing with warm or cool water. Then dry with paper towel, utilizing that paper towel to turn off the taps. Not touching any surface of the soap of the sink, tap, or walls, or paper towel dispenser. This facilitates not recontaminating the hands with dirty areas. Hands should not be dried with dirty paper. Then you are just re-dirtying the area. You are being ineffective in your efforts. Lack of compliance among nurses is related to causing harm to patients. It's the cause of soaring HAIs in patients, increased morbidity rates, and higher financial costs to hospitals, patients and their families. It's not only the financial costs, it's the number of lives lost unnecessarily. A hospital-acquired infection, known as a nosocomial infection, occurs while a patient is in the healthcare setting, which was not present during the time of their admission. These are preventable infections. They can be prevented simply by washing your hands. You go to a restaurant, they say wash your hands before going back to the kitchens to prepare food. You as a nurse, you take an oath to first do no harm. Wash your hands before going from one room to another. Wash your hands when they are visibly soiled. Use the hand sanitizer when you are in doubt, and then soap and water before touching a patient. This is to save lives and make all effort to continue to care for these people who are entrusting you with their care. It's not a matter of saving dollars, it's saving lives. Compliance is important in all matter of life-saving efforts. Best practices save lives. Compliance is an issue that is an effort that everyone should take in order to save the lives of those we love. In an effort to save lives and be compliant. All nurses, all healthcare workers, everyone that loves someone, wash your hands. It would be a terrible thing to go to the hospital because you have a cold, a bad cold, and not walk out because you've acquired a disease from someone who does not wash their hands, from bad habits. Thank you.